The coronavirus is spreading around the world, and some countries are taking drastic steps to try to stop its path.
The Italian government tonight put the entire country on lockdown.
The central bank has devised a plan to deep clean China's cash.
Governments across the world wrestling now with just how far they need to go to stop its spread.
While the scope and scale of the virus here in the U.S. continues to grow, the U.S. federal government is facing the challenge of containing a widespread outbreak.
The burden for getting us prepared, for protecting us, falls on the federal government. That's why we have it.
The World Health Organization has reported more than 160,000 cases of the novel coronavirus, responsible for the disease called COVID-19, globally as of March 16th.
If you look at the curves of outbreaks, they go big peaks and they come down. What we need to do is flatten that down.
The impact of the coronavirus is rippling through the global economy and world stock markets, prompting policymakers like the Federal Reserve to enact emergency measures not seen since the financial crisis.
We saw a risk to the outlook for the economy and chose to act.
In China, more than 80,000 cases of the virus have been reported since mid-January. The Chinese government put measures in place, like mandatory regional quarantines for tens of millions of people, to try to stop it from spreading further. The U.S. government has declared a national emergency and imposed mandatory quarantines for the first time in decades, as more than 4,000 people have been exposed to the virus.
We haven't had a real federally sponsored quarantine in more than 50 years, so we are in unprecedented territory.
So what can the U.S. government do to contain an outbreak, and what lessons has it learned from past pandemics? Some experts have compared the coronavirus to the 1918 influenza pandemic, also known as the Spanish flu. One reason for this is they both have very high mortality rates. During the 1918 influenza pandemic, mortality rates were around 2%. That means the disease killed roughly 2% of all the people who were infected. By comparison, normal strains of the flu today have a mortality rate of around 0.1%. Early estimates from the World Health Organization have found the mortality rate of COVID-19 is around 3.4%.
This is not just the flu. It's probably 10 times more deadly than the flu.
These numbers have prompted some to worry that the coronavirus pandemic could reach the scale of the 1918 influenza pandemic. The Spanish flu killed more than 50 million people worldwide, including 675,000 in the U.S., making it the deadliest flu in the past century. In total, an estimated 500 million people were infected with the virus, 1/3 of the world's population. The Spanish flu occurred in 3 waves: the spring of 1918, fall of 1918, and spring and winter of 1919. And the U.S. government had limited resources to fight it. The country was suffering from a shortage of doctors and nurses following World War I, with an estimated 30% of all U.S. physicians engaged in military service. The federal government passed a $1 million budget in 1918, equal to more than $16 million in today's dollars, to recruit medical doctors and nurses. In 1918, there were no lab tests that could detect the virus and no vaccines to help prevent the flu's infection. So government officials relied heavily on so-called non-pharmaceutical interventions. These included measures like isolation, quarantine, and limits on public gatherings. Policemen patrolled the streets wearing masks, schools were closed, and public events were canceled. Many of these non-pharmaceutical interventions were instituted not at the federal level, but by state and local governments. But despite some of these steps, fear and panic spread across the U.S. Meanwhile, local officials weren't always transparent about the severity of the disease. In Chicago, the mortality rate at one hospital reached 39.8% in 1918, yet the city's public health commissioner proclaimed, "Worry kills more people than the epidemic." This lack of communication and transparency created distrust and even more panic, and serves as an important lesson for future outbreaks. An analysis of the 1918 epidemic by the Institute of Medicine put it this way: in handling any crisis, it's absolutely crucial to retain credibility. Giving false assurances is the worst thing one can do.
Advancements have made it much better and probably will help us prevent ever having something like the 1918 pandemic flu happen again in the world, but we still have to take appropriate actions, and there are some common sense things people can do.
Today, the federal government has a chain of systems in place in case a pandemic hits. Here's how that response should unfold according to standard protocol. The Department of Health and Human Services, or HHS, leads the way, overseeing a web of other agencies, including the Centers for Disease Control and Prevention, the CDC, the Food and Drug Administration, FDA, and the National Institutes of Health, NIH. HHS also manages the Strategic National Stockpile, which is the country's largest supply of pharmaceuticals, masks, and other medical supplies.
It's basically treated like you would think a hurricane response, where FEMA leads, but in this instance, HHS leads, and everyone else in the department is there to support HHS in responding to the public health and medical needs of the country.
Typically, the first thing HHS would do is declare a public health emergency. This frees up some public funding for health emergencies. The department may also issue guidelines on travel. Experts call this first phase containment. HHS did this for the coronavirus back in January, when it was picking up steam in mainland China.
That the coronavirus presents a public health emergency in the United States.
Action 1, containment. So you try to make sure anyone who has the disease doesn't infect anyone else, and make sure you try to keep the disease out of the U.S. if it's possible.
The next phase is called mitigation. That's where the CDC takes center stage, setting guidelines for hospitals, schools, and businesses around the country. The agency works with state and local health departments by sending out testing kits and explaining procedures to identify patients who are infected. In mid-March, the CDC recommended individuals and organizations should cancel events with 50 or more people because of the coronavirus pandemic. Congress can also authorize funding to states for public health emergencies.
Ultimately, the state and local folks are the front line, and they've gotten funding over the years from the federal government, more than $600 million a year, to help prepare them in the event that this type of thing happens.
State and local officials must decide whether to carry out the most extreme step when it comes to fighting an epidemic: imposing a quarantine. The federal government has the authority to impose quarantines as part of the Constitution, but this mainly extends to people entering at U.S. borders or traveling between states.
Ultimately, the decisions about things like quarantines and school closings, business closings, that's going to be a state and local decision, not a decision made in Washington.
So we can look at recent epidemics like smallpox, SARS, or Ebola to get a glimpse at the different responses from the federal government today. First, think of the smallpox outbreak in the 1950s and 60s. Warning, these images showing the toll of the disease are graphic. It killed 300 million people in the 20th century alone. The last time the U.S. government issued a federally sponsored quarantine was to help contain smallpox. The quarantines were used as part of a broader global effort to fight the disease. Mass vaccination campaigns were crucial to the fight, and ultimately, the World Health Organization declared smallpox eradicated in 1980.
We did it with smallpox through vaccines. We just blanketed the world with vaccines until we got every single case.
Then there was SARS in the early 2000s. The disease spread quickly throughout Asia and infected more than 8,000 people, with a mortality rate of 9.6%. The Chinese government issued a large-scale quarantine to try to contain the virus, but it didn't exactly work.
In China during the SARS epidemic, when the government announced a quarantine area, 250,000 people fled. Well, that doesn't help the epidemic.
Instead, what did work to contain SARS was a combination of travel warnings, detailed reporting of new cases, and close collaboration between labs and scientists around the world. Most recently, there was the Ebola epidemic from 2014 to 2016. The virus that started in Africa highlighted the need for U.S. government officials to work with international partners to fight the disease at the source. More than 2,000 CDC staff were deployed to Guinea, Liberia, and Sierra Leone during the epidemic. President Barack Obama appointed Ron Klain to oversee the government's Ebola response in 2014.
In fighting Ebola, we had 11 federal agencies involved in a major way, 17 involved in some ways. That included all of our agencies on the international side, defense, state, USAID, fighting the disease overseas, and it included a lot of efforts on the domestic side.
The U.S. government's response to the coronavirus pandemic has been controversial. Some have criticized the Trump administration for being slow to respond and failing to communicate the steps it's taking to contain the outbreak.
White House officials are growing increasingly frustrated at what they see as President Trump's persistent attempts to minimize the threat posed by the outbreak.
In March, Congress authorized an $8.3 billion spending package to fight the coronavirus. It included billions of dollars for vaccine research and preparation efforts.
And I'll take it.
The CDC has faced criticism for distributing faulty test kits and slowing down local efforts to test the virus. Meanwhile, health officials are still trying to understand exactly how it spreads. Companies have encouraged workers to stay home and limit travel, while some states have even banned large public gatherings.
The idea behind social distancing is that, we kind of give up on the fact that we're going to just stop this disease, but we try to slow it, we try to delay it. Kind of buys us time before we can get a specific treatment for COVID-19 and ultimately a vaccine.
Experts agree clear communication from the federal government and social distancing measures are key to containing this outbreak. To help prevent the spread of COVID-19, the CDC recommends taking common sense measures like washing your hands often, avoiding touching your eyes, nose, or mouth, staying home when you're sick, and covering your cough or sneeze.
What are my ethical and social responsibilities to my family, to my neighbors, to my community, to my nation? And we need to recapture that sense of the common good.